Erectile dysfunction, ED, commonly known as impotence, is a widespread condition that affects millions of men globally. It involves difficulty in achieving or maintaining an erection sufficient for sexual intercourse. This condition not only impacts physical health but also emotional and psychological well-being. Here's a detailed look at the causes, symptoms, and various treatment options available for erectile dysfunction. What is erectile dysfunction? Erectile dysfunction is characterized by the regular or repeated inability to obtain or maintain an erection. While it is not uncommon for men to experience this problem occasionally, persistent ED can be a sign of underlying health issues that need addressing or emotional and psychological concerns. Causes of erectile dysfunction. The causes of erectile dysfunction can be divided into physical and psychological categories. Physical causes: cardiovascular diseases, diabetes, hypertension, high blood pressure, high cholesterol, obesity, hormonal imbalances including low testosterone, certain prescription medications, alcoholism and tobacco use, sleep disorders, treatments for prostate disease, injuries affecting the pelvic area or spinal cord. Psychological causes: stress, anxiety, depression, relationship problems due to stress, poor communication, or other concerns. Symptoms of erectile dysfunction. The primary symptom of erectile dysfunction is the inability to maintain an erection. Other symptoms might include reduced sexual desire or libido. Men experiencing these symptoms consistently should seek evaluation for ED. Diagnosing erectile dysfunction. Diagnosis begins with a physical exam and a review of symptoms. Doctors may also use several tests to diagnose ED and determine underlying causes: blood tests to check for signs of heart disease, diabetes, low testosterone levels, and other health conditions. Urine tests to look for signs of diabetes and other underlying health conditions. Ultrasound to examine the blood vessels that supply the penis, usually performed by a specialist. Psychological exams to screen for depression and other psychological issues. Treatment options. Treatment for erectile dysfunction varies depending on the cause and severity of the condition, as well as underlying health problems. Some treatment options include medications. Oral medications such as Viagra, sildenafil, Cialis, tadalafil, and Levitra, vardenafil. Other medications such as alprostadil, self-injection or urethral suppository. Lifestyle changes: exercising regularly, eating a balanced diet, reducing alcohol consumption, quitting smoking, managing stress and anxiety. Counseling, psychological counseling to address anxiety, depression, or other mental health conditions. Physical treatments, vacuum pumps, surgical implants. Conclusion: erectile dysfunction is a treatable condition. With the right treatment, most men can manage their ED symptoms and achieve a satisfactory sex life. It's important for men to discuss their symptoms openly with their healthcare providers to determine the most effective treatment plan. Remember, ED can also be a sign of a more serious health condition, making it crucial to not ignore symptoms when they occur.